Today, let us know about the topic atherosclerosis. Atherosclerosis is a form of arteriosclerosis and it is characterized by intimal lesions such as atheromatous plaques. Arterial wall consists of three layers: tunica externa, tunica media, and tunica intima. In this intimal layer, these atheromatous plaques are present. Atheromatous plaques are formed by fatty substances, cholesterol, cellular substances, calcium, and fibrin deposition. Now let us see what are the vessels involved. Large elastic arteries, aorta, carotid, and iliac arteries, and other one is large sized muscular arteries, and this is coronary artery, and medium sized muscular arteries such as popliteal artery. Major risk factors involved are modifiable factors, non-modifiable factors, and others. First of all, let us see what are the modifiable factors. Modifiable factors indicates that which are altered. They are cigarette smoking, diabetes mellitus, hypertension, and hyperlipidemia. Non-modifiable factors, these are constitutional factors, and they are male gender, advanced age, family history such as familial hypercholesterolemia, and others are inflammation, hyperhomocystinemia, metabolic syndrome, and lipoprotein A. Now let us see pathogenesis. Endothelial injury and dysfunction causes increased vascular permeability, leukocyte adhesion, and thrombosis. Second step is lipoproteins, mainly LDL, that is low density cholesterol, and its oxidized forms accumulate in vessel wall, and monocytes adhere to the endothelium, followed by migration into intima, and this transforms into macrophages and foam cells. Fourth one is platelets adhere to subendothelial matrix, and thereby factors released from activated platelets, macrophages, and vascular wall cells induces smooth muscle cell recruitment either from media or from circulating precursors, and these smooth muscle cells proliferate with production of extracellular matrix and recruitment of T cells. Lipid accumulates both extracellularly and within the macrophages and smooth muscle cells. Now let us see morphology of the atherosclerosis, fatty streak and atheroma. Two stages were seen in morphology, earlier stage and later stage. In earlier stage, fatty streak is formed. The gross appearance of fatty streak is a flat yellow intimal elongated streaks, whereas microscopic changes are composed of lipid-laden macrophages, and these are called as foam cells. Whereas later it develops into atheroma. Atheroma is otherwise called as atheromatous plaque or fibrofatty plaque. Gross appearance of atheromatous plaques used to be in white or whitish yellow, eccentric, raised lesion, and the microscopic feature of atheromas is it consists two types: fibrous cap and necrotic center. Fibrous cap is composed of smooth muscle cells, inflammatory cells, and dense collagen, whereas necrotic center consists of dead cells, foam cells, lipid, and plasma proteins. Now let us see the fate of atheroma. Atheroma's fate is calcification, rupture, ulceration, or erosion of the surface, or intraplaque hemorrhage. Complications of atherosclerosis is myocardial infarction, stroke, aortic aneurysm, mesenteric occlusion and bowel ischemia, ischemic encephalopathy, and peripheral vascular diseases. Thank you. Thanks for watching. Do like, share, and subscribe the channel.